Yeah, between and the beauty of psychotherapy is that the person, the patient, the client does not have to do all this complex process you're describing himself or herself alone.
Right.
He or she has actually the help in the room of a psychotherapist who is aware, ideally, of everything you just said and beautifully summarized, but he can also, with his own, cortical activity and even body activity, actually resonate and help and bring some order into bring some understanding into maybe some disruptive, difficult experience of the client. He can formulate in his head or her head some, hypothesis. Why is this that this client is there? Is this anxiety, cannot express his anger? And then according to this, formulation, actually make appropriate interventions, give tasks which are, helpful for this individual. Let's say, awareness raising tasks, mindfulness, I don't know, right? What's helpful in the specific moment. So it's actually a dyadic process, I guess. That's what I'm saying. It's not just the client, right?
Oh, completely. So, and our first off, us as primates, we're unbelievably relational. We actually have a huge, especially for these socio-emotional internalized, they're all self-other relational fields. They start with attachment. So the first person we know is not ourselves, but mom. Okay. And that's that actually we engage all attachment theory, interpersonal neurobiology shows, we have a co-regulatory structure and we mirror and use others very intimately. That means then that if the therapist can enter into that intersubjective field, right? There's most individuals, of course, severe attachment, other things are going to have problems with this, are looking for resonance. If you're a healthy resonator, you can literally, doesn't need to be cognitive. You can actually hone your animal and primate self in proper relation. You then mirror and then intuitively demonstrate the adaptive metabolic process of the relation between, and you show how you do it vertically within and hand that back to them intuitively. So in the relational dance in that regard, you can immediately see why there's lots of reasons why a very high quality therapeutic relationship is valuable. You confer relational value to the individual, which is a core need in relation. But then if they trust you and then they're going to use you as a particular kind of model and you hold that in a particular way, you mirror back that, the intuitive system is going to be modeling and mirroring you and you, oh my gosh, that person. So you don't even need to do that. It's in definitely a participatory dynamic stance. And that can be enacted from a bottom-up position because an enormous amount of that is internalized. I'm particularly, my gifts, or I like to say my superpower in therapy is a conceptual problem solver. So for me, idiographically, given my background, I often ask my doc training students, what's your superpower? What your unique idiographic, are you really attuned to individuals, right? Do you really have some good gifts with affect? Are you really creative to cultivate possible associations and then afford participatory relations? Do you know interoceptively your body in a particular way, a dancer, okay? Me, I'm a conceptualizer. So my capacity is then to follow these affective, relational, developmental, psychodynamic processes and afford the capacity of the ego to upgrade its rich textured narrative and then bring awareness of the narrative to cultivate acceptance and active change in that regard. But yeah, no, totally. These are to me, if you listen to this kind of description, what we're actually seeing is, oh, this is what the science would say, okay, at a general level. And then this is what all the therapeutic wisdom from a number of different traditions potentially would say. Very few would essentially disagree with this. They would just emphasize in different features. And if we can have that kind of thing, what would it be like if we shared a common core?